Quitting is hard, but life is better without the but. Smoking, vaping, and the use of tobacco-related products are the leading preventable cause of disease and death in the United States. Tobacco smoke contains a mix of over 7,000 chemicals, many of which are harmful. In fact, according to the CDC, cigarette smoking kills more than 480,000 Americans each year, with an estimated 14% of U.S. adults considered current cigarette smokers as of 2019. This has placed a considerable burden on U.S. healthcare, resulting in more than $300 billion spent every year treating smoking-related illnesses. In recent years, vaping has seen a rise in popularity. Although vaping is often considered to be a safer alternative to smoking, studies have shown that vaping can coat your lungs with potentially harmful chemicals. Vaping also serves as a gateway, leading many adolescents to explore other nicotine products. And because of the addictive nature of nicotine, many people find themselves dependent on such products. So what makes nicotine so addictive? Nicotine triggers the release of chemicals in your brain such as dopamine that make you feel good. A slight surge of endorphins in the reward circuits of the brain accompanied with brief euphoria is enough to keep many people hooked, even in the face of the numerous negative consequences of nicotine use. So what are the risks associated with using nicotine? First and foremost, smoking and the use of nicotine products is associated with an increased risk of cancer almost anywhere in your body. There is an increased risk of cardiovascular, respiratory, and gastrointestinal disorders such as stroke, coronary artery disease, COPD, worsening asthma, rheumatoid arthritis, diabetes, and overall elevated inflammation. Reproductive health is affected, making it harder for women to have a successful pregnancy and resulting in a greater risk of erectile dysfunction in men. Accordingly, the life expectancy for smokers is at least 10 years shorter compared to non-smokers. Tobacco and nicotine use also harms the people around you. Every year, exposure to secondhand smoke causes an estimated 41,000 deaths and even more complications among adults in the United States. The list goes on, but it's more important to focus on the health benefits after quitting, because there are countless. Just after 20 minutes of quitting, your heart rate drops. After 12 hours, the carbon monoxide levels in your blood drop to normal. Within 2 to 3 months of quitting, your circulation improves and your lung function increases. After 1 to 9 months, coughing and shortness of breath decrease. After 1 year, your added risk of coronary heart disease is half that of a smoker's. 2 to 5 years after quitting, your stroke risk is reduced to that of a non-smoker. After 10 years, your risk of dying from lung cancer is about half that of a smoker's. And after 15 years, your risk of coronary heart disease is the same as that of a non-smoker. Along with the health benefits, you can also expect changes in your appearance. Your breath will smell better, teeth will be whiter, and you'll be more appealing to partners. In the long run, you'll have fewer trips to the doctor, lower costs on health and life insurance, and you'll be saving money. To sum that up, quitting will give you more energy, focus, and time to do the things that matter to you. With all these benefits in mind, there's a good chance you want to quit. So where do you begin? First, find your motivation. This is a life-changing decision, and the key to success is to stay on track. Along with the benefits we covered earlier, what are your reasons for wanting to quit? Setting a quit date that has meaning behind it, such as a birthday, anniversary, or holiday, can give you a goalpost and allow you to track your progress. Telling family, friends, and coworkers that you're close with can help create a support group that can motivate and cheer for your success along your journey. The difficulties in quitting are often caused by withdrawal symptoms, so anticipate and plan for the challenges ahead. You can pick up healthy habits to curb cravings and keep yourself occupied with activities such as exercising, gardening, playing a game on your phone, and snacking on fruits, veggies, seeds, or nuts. Along the same lines, try to avoid habits or routines that trigger the urge to smoke or use nicotine products. Quitting is a long and hard process, and struggles can be expected, but know that there are resources out there to help you. There are 7 medicines approved by the FDA to help you quit. Nicotine replacement options such as gums, patches, and lozenges are available over the counter and covered by some insurance plans. Nicotine is a drug, and as with any other drug, there are side effects. Talk to your doctor, pharmacist, or other healthcare provider for additional information and advice. We can rise against this together, and we'd like to point you in the right direction. So if you're interested in hearing more about the health benefits of quitting and the resources available, check out the related links in the description. Start stopping today. Quitting will make for a happier, healthier, and wealthier you.